Many patients aren't aware of their tooth, their own blood, and modern biologics can help regenerate gum and bone tissues. How the body can rebuild bone and heal faster.
Patient acceptance is number one. This attracts patient's own cells, repair cells into the area.
Is it really essential to do CTG for gum recession?
It offers strength and support to the gum area to make it build more keratinized tissues. Keratinized meaning nagkakalyo.
Kalyo.
Okay, they found out that soft tissue or gum cells go to the defects faster than bone cells. So, kailangan mong harangan.
Is there any chance that this artificial membrane be rejected by our body?
Yes, it could fail because of certain situations like kung marumi yung barangay, mangangamoy at mangangamoy yung dumi at maaamoy mo. So, lahat siya maapektuhan.
Understanding this can change the way we approach gum disease, tooth removal, and bone loss and healing. Today, periodontics is no longer about just healing. It's about regeneration. Beneath our gums, where blood and bone and biology meets, there's an entire world of healing. Welcome to Beyond the Brush. I am your host, Dr. Anne Villanieva-Perez. I am today talking about how the body can rebuild bone and heal faster and restore your smile in a way that people don't know yet. We're joined by someone specializes in this area. Welcome, Dr. Benjamin Racela, MS Perio Resident, and Chairman of the Continuing Education of the Philippine College of Oral Implantologists. This is important because many patients aren't aware of their tooth, their own blood, and modern biologics can help regenerate gum and bone tissues. Understanding this can change the way we approach gum disease, tooth removal, and bone loss and healing. So let's dive into the generation and how the body itself becomes the healer. Doc Ben, let's start with something most patients don't know even exists. The autologous bone graft, the tooth bone. Can you explain it in a simple terms what it is?
First of all, Doc Mia, thank you for having me here. Let's talk about what you just mentioned, autologous tooth bone or the auto tooth bone. As we all know, the tooth consists of both enamel and dentin. Lahat tayo, we're all familiar with that. So enamel is just like bone because it has minerals, especially calcium phosphate minerals called hydroxyapatite that is very similar to bone. The dentin part has organic and water components, again, similar to bone. So it's just but natural that when you grind, when you pull out the tooth first, sterilize it, grind, and pulverize it either into a block form or powder form, you can now use it as your auto tooth graft. So some people call it my tooth bone.
Yes. So what makes this technique even effective than the traditional bone graft?
First of all, it's very easy to push, easy for our patients to understand why it's effective because it comes from their own body. You know, a tooth that you just would throw away, now it becomes beneficial to you because of its properties of what you call osteoconduction and osteoinduction, making it a good gold standard. Plus, the cases of rejection, which can happen with a graft material, is already managed because, again, it came from your own body. So rejection and, infection is hardly around.
How about this so-called PDRN? Most people hear this in skincare, but what does PDRN do in dentistry?
First, probably let me explain what PDRN stands for. It stands for polydeoxyribonucleotide. Though very technical, this PDRN has what you call three mechanisms. First, blood formation or new blood cell formation. It also offers reduction in inflammation or anti-inflammatory effect. And thirdly, it helps build blocks that are very important in cellular repair because of the DNA component of PDRN. So because of the presence of these three mechanisms, it accelerates already wound healing.
How does PDRN help the gums or heal faster?
When they say, when you add itis to a word, appendicitis, the appendix is inflamed. So in terms of dentistry, specifically periodontal dentistry, you talk about periodontitis. So there's the itis to that word. So itis meaning the gums are inflamed, the periodontium are inflamed. With this anti-inflammatory property of PDRN, because of the presence of or the activation of adenosine receptors, pardon the technical term, but the
Yes.
adenosine receptors is like a balancing act of uh, do I produce more pro-inflammation products or more anti-inflammation products? So with this one, with the PDRN, anti-inflammatory products or byproducts are more produced, thereby controlling inflammation and helping manage the itis part, the periodontitis.
Next is the PRF and CGF. Let's have a short discussion about it. So these come from patients' own blood. So how does CGF and PRF helps in the healing process of these patients with periodontitis?
Again, Doc Mia, patient acceptance is number one because again, it came from their own blood. You draw out the blood, put it in a machine called centrifuge, and by doing so, it comes out with three layers that are filled with growth factors, and you get them and turn it into what you call a natural bandage.
Yes.
And this natural bandage is what we see like a three-dimensional gel material, like literally like a band-aid. And this attracts patients' own cells, repair cells into the area. So very important, most especially growth factors.
How about CTG, connective tissue graft? Is it really essential to do CTG for gum recession?
Okay, it's what we call the treatment of choice if you have gum recession. CTG, how is it performed? We usually get it from the patient's own palate, thereby answering questions about will the color be different when I put it into the area where my gums are receded. It offers strength and support to the gum area to make it build more keratinized tissues. Keratinized meaning, I would say in Tagalog, nagkakalyo
Calcio.
compared to a very thin gum area. Okay? So, mas gusto natin a thicker, nakakalyo na gum area, thereby reducing sensitivity, helping build gum tissue, and also reducing, I mentioned already, sensitivity, but again, building blocks for gum repair.
And finally, regarding guided bone regeneration, when do we use artificial membrane and how does it work?
Remember, Doc Mia, there is this what they call PASS principle, no? P stands for primary stability, A angiogenesis, S space maintenance, and the other S is stability. So dito papasok ang membranes sa space maintenance. Okay, they found out that soft tissue or gum cells go to the defects faster than bone cells. So kailangan mong harangan. So that's what you call, some barriers are what they call selective barriers that allows or occludes gum tissue or epithelial cells from migrating faster. Pinapauna muna nila yung bone cells to go into the defect. So yan ang importante. Plus, the remember when you cut or when you perform surgery, there is a clot buildup. So the clot also goes into the membrane and helps build growth factors at the same time. So basically, very important siya in GTR and GBR cases.
Is there any chance that this artificial membrane be rejected by our body?
Probably the term would not be rejection, but probably yes, it could fail because of certain situations like infected yung area. I always tell my patients it's like a community, a barangay, no? Kung marumi yung barangay, mangangamoy yung dumi at maaamoy mo. So, lahat siya maapektuhan. So, we also should not just focus on the defects alone. You have to focus on the other teeth, the gum condition of the other ears, and also if there's a underlying medical condition of the patient. For example, diabetics that are prone to infection. Those are the instances that it may be rejected, but not necessarily a failure.